gym, put ice on the go. Chili with enough bell money to free the people. High stakes, I got more at stake than Philly. Shopping sprees, copping 3. Deuce fever, IS's fully loaded.
What's up, what's up, what's up? How y'all doing? Stoop is checking in. What's up, what's up?
Stop dreaming, I leave your body steaming. Niggas is meaning, what's the meaning? I'm meaning no eating. No eating, nigga intervening with the sound of my money machining. My cup overflowing. Don Juan DeMarco, swear to God, don't get it fucked up.
Thank you for my boy Gab. What's up? How y'all doing? How y'all doing? What's up, Bufante?
This shit can't knock the hustle. That scene out of state. Me and the band, the worst fear confirmed. Me and my fam roll tight like the firm. Get down for life, strap. Better learn why I play with fire, burn. We get together like a choir to acquire what we desire. We do dirt like worms, produce G's like sperm. Till legs spread.
Messed up the connection real quick to come back.
Yeah, y'all niggas lunching, punching the clock. My function is to make much and they back munching. Sipping Remy on the
My fault. For some reason the connection messed up for a sec. I know. Yeah, what's up? What's up, people? How y'all doing?
Stack rocks like Colorado. Chris Nails by the bottle. It's the damn chain, what you not know. Me, slick like a god.
What's up, people?
Yo, what's up, man?
Had to knock off the rust a little bit.
Knock it off.
We coming back. Exactly.
Knock it off. You don't want to be like McGregor out here, man.
Exactly.
Rust out here. What's going on, people? What's up, Lillian?
How you doing, bro?
I'm chilling, man.
Get it going.
Can't complain. What's going on, everybody? I hope y'all are in good spirits, good health this evening. My name is Gavin Webb. I am the senior producer and correspondent here at From the Front Lines, STOOP55's From the Front Lines. I'm joined here with my boy, my bro, Dr.
What's up?
Cooper. What's going on, bro?
What's good with you, man? You know, living life one day at a time. You know, we back at it a little bit. Just wanted to touch the street a little bit. Then roll back out, let people know we still out here, still thinking about what's going on. How you been, man?
I've been good. I made it to 2021, and I'm healthy. I'm in good spirits, so I can't complain, man.
Take it.
Rolling into this next year with a bat on my back and some good. I can't complain.
I got you. So what's on the docket for today, bro? What's up?
Docket today. So today's episode is Black Health, COVID, the vaccine, and trust. What's going on with the trust, the Black community, and the health institution that this country set up for us, man? There's a lot going on. New administration. We got a new president in office. A lot's happened since the last time we logged on and talked to y'all. I know, Matthew, you've been at work over the past year, and you got the COVID vaccine. I know you had talked to the people a little bit. What's your experience? How you feeling, man? You got any bugs right now? You feeling good? You feeling healthy? Did it work?
I'm feeling good. No lie. I'm not gonna lie. Going into it, I was concerned. You know, I had some hesitations. I think I was like everybody else, even with my medical knowledge, even with being able to understand, read, digest the research. I was apprehensive because it is relatively new, like it's a new vaccine. Let's not take anything away from that. Now, the research isn't new. The research behind it isn't new, but testing it on people is fairly new compared to, especially how fast it was created. You know, I was apprehensive about it. But it's one of those things that I was seeing a lot of patients that were suffering from it. Now, we're not just talking about dying from it. We're talking about getting the infection, And then even after they recovered, having long-term consequences of that infection. And even now, I see it all the time. And so it was really concerning. You know, I see a lot of my fellow colleagues, not just people who are not just seeing patients directly, but friends, family also have been affected by it. So if I could do anything in my part, not just to help protect myself, but in part help protect the people around me, help protect the patients I see, I'm definitely gonna take that step forward.
Sure, sure. Very understandable and responsible of you as a doctor. Others before yourself, so you're taking this vaccine. I mean, for those outside the medical community that, haven't gotten the vaccine, I mean, I feel like there'd be a benefit in getting it outside of just like helping the people around you. But, obviously there's a debate with the issue of getting the vaccine or not, specifically when it comes to the Black community. There's trust, lack of trust there.
Yeah.
How do you feel about that? What are you hearing? Like, is there information that you can contribute?
Yeah, I mean, we don't even have to talk about me being a doctor and know about this, you know? Just
Yeah.
being Black, having our ears open and listening to people around us, right? This is my family, my close friends are concerned about taking it. And some are saying, like, you know what, I'm not going to take it, even with me speaking with them. And so I think there has to be an understanding that this is relevant historical, political, and like social aspects to in the beginning. I was really frustrated and upset when people would say, you know, I'm not taking that, forget about it. But I think it took me some time to understand that you have to meet people where they are. I can't be set with convincing everybody every single time. It's like, you know, it's more of a personal decision than I thought it was. And then you kind of have to come to it yourself, really, come to an understanding, because everyone comes with their own perspective on what's going on, and the medical field in general. But
Sure.
what about you? What do you think?
I mean, I'm lucky enough to have a good friend that's a physician. So obviously, like talking to you about, my concerns and the lack of knowledge that I have about vaccines and so forth, the information that I'm finding myself, just reading sources, I feel like it will be beneficial for me to get the vaccine,
So
Um, I'm,
tomorrow, say tomorrow, you know, we have the vaccine tomorrow. It's available to you. Would you take it?
I would.
You
I
would.
would. Preferably because, I'm around my family members a good amount of the time.
Mhm.
Uh, my parents are older and they definitely are in the best conditions all the time because of their age. So, I too would probably take it for the benefit of them, to keep them healthy.
Mhm.
But yeah, more or less for that, I feel like I have a strong enough immune system that I could handle getting a little bit sick because of this vaccine.
Yeah.
But I feel like I would take it. But I mean, to be honest, it's hard. It's
Yeah.
hard. Like obviously, there is a history with the Black community having trust with the
Mhm.
healthcare institution in this country, and the past year that we've had, or 4 years that we've had with the administration and how they've sort of run things, that distrust has only increased. Right? It's only in the past month that there's been like a It's hard. It's a hard choice, but I mean, if it was available to me tomorrow, I feel like I would take it. But like, what do you feel about that as far as, the shifting of the government right now and, the lack of trust that was increased over the past 4 years with Trump being in office, and now there being like new campaigns and initiatives with the vaccine getting it pushed out and whatnot. Like,
I think it's hard to deal with the amount of trust or distrust with like all these governing bodies, right? Because you automatically think, all right, it's the government, but Black people already know the government has always been for us, right? We've been disenfranchised. We've been um, kind of taken away from our political representation. We've been knocked out of economic gain for like years and years and years. So to say people are like, oh, you know, they're kind of wary about government. We've been wary about government for a while. We've been wary about government. We've been wary about extensions of the government in the security force in our neighborhoods, and it's a different kind of life we have to live to that extent. And so it becomes hard when, as a healthcare provider, to be understanding of that distrust, even as it extends into medicine and into patients' homes, and at the same time, for some Black people, having the point of view that I'm also a part of that system that might be oppressing them. Does that make sense?
Yeah.
So also it's frustrating to be kind of in between. Say like, you really should be taking this, you should be taking this, but at the same time, I'm almost can be seen in some regards. Some people look at me as like a puppet, as a part of the system, which is kind of rough to hear. And so I don't know. I think it's great that obviously Biden won. We have Kamala in the House. That's great. And so I think we put a little bit more trust in the words that are coming from the top. And then from that trust is kind of extended on to our kind of medical bodies, like listening to what the CDC is saying, listening to what our local public health officials are saying. Even look at Fauci now. Fauci's looking good. Fauci feels great. He already, as soon as it switched up, he came out saying how terrible it was to be under the Trump administration, right? And so now I feel like he can move. He can be free and can honestly and appropriately say what he thinks is going on. And I think that kind of trust is huge. It's pivotal for everybody in the country, but especially the Black population.
For sure. As far as like the rollout, of the vaccine and how that's sort of being allocated and distributed. I mean, it's like Black people have a distrust with the government. A lot of people don't want to take it. But I feel like the people that are more prone to getting the virus and those who might need it the most would be that community, right? The Black community. How is there going to be some type of solution or, some type of action made to sort of fill that gap as far as distrust and then it being allocated to the community that most needs it, right? Like, I know we spoke a little bit, like, offline as far as things that you're doing with Ochsner and campaigns and reaching out to the Black community. Could you talk about that at all? I know, Biden's administration had talked about certain campaigns that they're targeting the Black community when it comes to the vaccine data information. Is there anything going on with that as far as like in New Orleans, things that you're doing?
Yeah, sure. So we're definitely taking the effort, and I think you're seeing this a lot in the Black, not healthcare kind of science community, really taking it on ourselves to be ambassadors and kind of champions of the vaccine. Not only being one of the first to take it, but also turning around and kind of being able to share our stories about how it was. And I'm not gonna lie, as I said, I was scared when I took it. I still had some side effects of it. I still had, muscle cramps. I was tired for about 2-3 days. And some people had worse. Some people had fever. Some people really were fatigued for a few days. So, I mean, to have side effects isn't abnormal for vaccines. But I want to be kind of clear and transparent in terms of what happened to me. So when the chance does come for other people, they can actually have an educated choice in terms of what they want to do or not. Because there's a lot of misinformation out there, right? And that's coming from all ends, not just, coming from the government before, but even within our Black community. There are I think, experts going out there to talk about what's going on. I think that's one of the reasons why we kind of have to portray our experiences, because they're very truthful. We try to make them as truthful as possible. So moving forward, that's really important for me. How about you? Like, what have you been seeing in terms of from your viewpoint, in terms of people trying to push the vaccine or trying to discuss their side effects? Any hesitance on where it's coming from exactly? Like if you see it on TV, Facebook, or something else?
Yeah, I mean, I don't know that many people that have gotten the vaccine. Obviously you and a few others, and they had similar symptoms of like, feeling a little bit fatigued or, like a mild cold, headache, nothing severe. As far as the information that I'm seeing, like in the media, it's a lot of noise, I feel. Especially, we were talking the other day, talking about entertainers and comedians and people that are outside of the healthcare community speaking on you know, what they're hearing about the vaccine, like anecdotal stuff, just rhetoric, you know, as far as like the misinformation that they're spreading. So I try not to listen to that. I try to listen to the experts as much as I can. I mean, to your point, you know, listening to an expert, but then on top of that, listening to an expert that actually took the vaccine, I feel like it's beneficial because it's like, all right, you've taken it, you're speaking to it as far as your personal experience, and then you're informed just because of your profession. I feel like that's an ideal person that I would want to listen to. And then reading, you know, as much as I can just about the vaccine. Um, yeah, like it's hard. It's hard. It's hard. It's definitely, you know, a chance, I guess, that you might think that you're taking when it comes to getting vaccinated. You
Mhm.
know, as far as my personal experience getting vaccines, like, you know, I've traveled to Africa and I've got vaccines for a bunch of stuff, you know, and I've had similar symptoms to that. And even in conversations with you and like talking about worst case scenarios of what might happen, you know, in getting a vaccine, that doesn't sound that bad. Like I said before, I have a really good immune system, so I'm not that worried about it. You know, as far as my parents, that's a different story, but I do think that they'd be better off. But I mean, overall, you know, looking at sources that make sense to look at when it comes to being informed by someone as far as getting the vaccine, and just, you know, going off of people's personal experiences that I trust. You know,
Mhm.
like if you
Yeah,
take it, tell me what happened with you.
I feel you. I feel you. So, I mean, as I was saying before, like I got the first shot I got, I'm not gonna lie, I got a little dizzy, but I didn't know if that was straight up from, like, oh snap, I'm about to take this vaccine that few people since in human history have taken. You know what I'm saying?
Yeah,
Like that gravity of it, I think hit me when I got it.
yeah,
Uh, Dizzy for a while, and then it went away. Then I was fine, and then the second one hit me a little bit harder. As I said, like I got some muscle aches for a few days. I used a leave, and I ended up feeling fine after. Uh, and then others did worse. Others, I know some colleagues who got like really lightheaded, were nauseous, ended up sleeping for like a 2 3 days, and then felt better after. But it usually was fairly short in terms of like, as I said, 2 3 days. But just like you said, millions and millions. I think over 3 or 4 million has already been given across around the globe. But that didn't come with any. They didn't come without risks, right? I think it was in one of the Scandinavian countries in like a nursing home. They had some deaths, which is, I mean, this is real. This is what happens with vaccines. It's very rare, it's like point 0.1 or whatever percent chance that this would happen to you. But these are happening in already very frail people. And so you really have to take a risk, especially by the time you're like 80 or 90 years old. Like this vaccine really may affect my health. But then again, what are the risks? You have to weigh those risks against the possibility of getting COVID, because that also can hurt people. You know what I'm saying? That also can kill people at that age. So, as I said, it's a very difficult decision. I see one of our homies over here had a question. What are they saying? Hold on, hold on, hold on. All right. They're asking, what are your thoughts on the fact in the UK there has been a law passed preventing the likes of Pfizer being sued? What do you think about that, son?
hmm, that's a tough one. So they're protecting themselves from a legal standpoint, giving them like insurance just in case something happens, I would suppose, to somebody that takes the vaccine. I mean, to your point of what you just said, like it is a risk and things have happened to people as
Mm-hmm.
fatalities.
Mm-hmm.
Uh, I don't know. I mean, it's almost like, all right, well, you're proving to me that it's definitely a risk taking this if you're trying to, you know, pass things that stop people from like suing you. But at the same notion, it's like, well, on the other side, I could get COVID.
Mm-hmm.
What's worse, right? Is it like, do I take the vaccine and risk like, you know, like getting sick, passing away, or do I risk getting the virus and having like a more increased chance of getting severely sick, you know? I mean, overall, I mean, it just, again, to your point, it just shows that there is a risk when you're taking a vaccine like this in this type of scenario. It's not easy. It's
It's
not.
nice, man. Yeah, Lillian was adding on. I think it's the case in the U.S. too, but it's hard when there's not any accountability, which I think adds to the distrust in what's going on. Right? Are you telling me this? I could do something. There's no accountability if I don't follow through, but or if not just follow through, but if I fail to a certain extent, not just like, hey, I have no accountability if somebody catches COVID, but I have no accountability if I give this to somebody, they might die. That's tough to hear. You know what I'm saying? It almost, especially with the way U.S. capitalism is kind of built. You know, oh, okay, they're just trying to make money on me, and they don't have to be held to a certain standard if they fail or they cause damage to me. Unfortunately, I can't think of a situation where a company, all these big pharmaceutical companies would make the vaccine if they felt like they would be at risk. You know what I'm saying? Because even to them, it's like, oh wow, we have confidence in this, but also we did this mad fast, and we did something that no one else in the world or anytime before us has done to a certain extent. So I'm not gonna lie, it definitely makes me feel uneasy. I'm not gonna sit here and be like, oh yeah, I'm cool with that, but there's not gonna be. I don't know how much difference or room to do something different there really was.
Do you think that it could be beneficial for somebody to wait a certain time period before they take the vaccine? Like if I wait 6 months and just see how this sort of pans out, would that be, an option that I could take? Or am I just adding to, people not taking it in the time needed to gain herd immunity or whatever?
I mean, the option, not taking it now allows you to see more people take it and their response to it. You know, as I said, for most vaccines, for a lot of the vaccines that we've had throughout our lifetime, usually the significant effects usually happens within the first like 2 to 3 months. And so we've been rolling out for this for some time now. And so if it's like, all right, yo, I want to wait those 3 months that usually associated with kind of negative effects with vaccines to see what's up. Past then, I there's no way I could tell for sure, but I don't think they're going to be very much long-term effects beyond that. Let me knock on wood right now because I don't want to be that first person, but that's truly my belief at this time. I see that there's a benefit. I don't knock it at all. I do think the more people get vaccinated, the sooner the better off we'll be to not just everyone being healthy, but for our own economy opening. I think what will happen, just like, you travel to the Southeast Asia, you travel to some parts of Africa, you can't walk in that country past the airport without a yellow card. You need a yellow fever vaccine, you know what I'm saying? And so for people who get out of line or upset with like, oh man, I need a card to go somewhere, I need this vaccine to go somewhere. It's already like that for yellow fever vaccine. I just think it's going to be the same way. Countries may do that, but is if you show you have the vaccine. And I think that's what's going to really push people into taking it.
Yeah. Yeah. Even going back to work, I feel like that's going to be a huge thing. People
It's
going
going to be.
back in buildings in New York City, it's like if you're not vaccinated, then that's not going to happen. I can't see that happening.
Got you. Doing that, I think Steve added on up the difference between SARS-CoV-2 and COVID-19. So yeah, I mean, it is kind of like comparing it. An analogy would be HIV to AIDS. So one is the actual name of the virus, and COVID-19 is the name of the disease. So SARS-CoV-2, right, is a type of virus, the virus that actually infects you, the virus particles that are actually used for the vaccine, the virus that you're actually looking for when you were testing. And then once you have an infection, the disease that the virus causes in the body, kind of constellation of symptoms and stuff like that, is called COVID-19. And so it's a little bit of a difference between the two. Just like I said, HIV is the virus that causes the disease AIDS. So a little bit of distinction between the two. Cool, cool. So my people, any other questions since we're here? We're gonna be on here for a few more minutes if y'all want to have any particular questions. Then we're gonna pivot to Clubhouse and see what's going on with there. You know, I was just talking to you about the stuff that happened with Tiffany Haddish in Clubhouse. What are your thoughts on that? And just give the people a little tidbit of what happened on Clubhouse.
Say that one more time.
I said your opinion on what's going on because we're pivoting to Clubhouse soon. Like
Yeah.
Haddish and the situation on it.
So I wasn't witness of it. I read a couple of articles, but supposedly there's a huge debate within the Black community on Clubhouse between emergency medicine physicians or just Black physicians in general. And like I was saying, just entertainers, comedians, you know, whole tap folk, as far as just, you know, the benefits, right, on the medical community side of taking the vaccine, and then, you know, the cons or risk in taking the vaccine from, you know, the Black folks within the entertainment industry and the whole tap folks. But yeah, I mean, it's very unfortunate. I heard that, what's her name, Tiffany Haddish, along with like some other comedians, started to sort of berate a young Black woman. She's an emergency medicine physician, I believe, when she was trying to.
She's like a PhD candidate.
PhD. Okay, she's a physician or PhD, epidemiologist maybe. But either way, they're rating her and getting on her because they thought that the information that she was giving to Black folks was null and void, and they were completely against taking the vaccine. They ended up putting her social media handles and information out there, and
Wow.
was you know, just harassed nonstop. And from what I heard, if I'm not mistaken, she tried to commit suicide because of that. I mean, that's horrible and disgusting, and I don't know why they would do that, especially when she's trying to inform. It's your job to inform and help as much as you can, but you're not going to be pushing the vaccine on anybody or forcing them to take it. I don't think that she was trying to do that at all, but she it was a huge cost to her trying to help out the community. I feel like it was unfortunate, but yeah, that happened. And I mean, what do you feel about that, just as a Black physician?
It's difficult because myself, I wouldn't want to put my. It's almost, I don't feel like I'm putting my neck out there, but it's almost like with the concern of being attacked, you don't want to share your personal experience that you feel like, you know, you trained for, you know what I mean, through all the years of studying for getting to the position you are. And it's so rare that people like ourselves from the community are in those positions to begin with, to come back and have someone who's also from the community kind of degrade you for trying to share their experience like that is rough to hear. It's rough to hear. So especially coming from kind of like these celebrities who should be really bolstering each other's voices in a positive manner, kind of using it to tear us down. So it's like, dag, it was rough to hear on that guy.
Yeah, that's unfortunate. That's unfortunate. And I mean, if we didn't already say it, because I feel like you said it, that we're going to be going on Clubhouse after this, and we're going to be having a discussion. So I invite all of you to join us.
For sure. Get your invites. Hit us up if you need an invite out there. For sure, for sure.
Invites for y'all. If y'all trying to come
Steve added on. Oh, good point, Steve. So Steve just asked. On so the vaccine prevents COVID-19, the disease. Yeah, so having the vaccine decreases the chances of developing the disease, so you can still likely get SARS-CoV-2, the virus. However, the vaccine is supposed to stop that transition from going from getting the virus to the actual disease state, like COVID-19 in and of itself. And even if you do develop COVID-19, the vaccine is supposed to make it a lot less severe. And so another great distinction, good point to ask Steve.
Yeah,
Oh, you did an iPhone for that situation. I see you, man. I see you look into it.
iPhone, that is right. Does anybody else? Or we gonna wrap it? Bring it to the Clubhouse?
Now, it was nice touching base with y'all.
It's a good discussion. Everybody hopping on. You need an iPhone for Clubhouse, right? Yes, you do need. Do you need an iPhone? Is it Android accessible? I'm not that sure.
I think you need an iPhone, son.
Okay. Yeah. All right. Sorry, Ava. You're very welcome. Dr. Cooper, you want to close it out with some.
Of course. It was a pleasure seeing y'all as per usual. You know, look out on the STOOP55 IG. We're gonna be coming back. You know, we're just formulating ourselves. We're watching. We're waiting. But any other questions, feel free to hit us up. Watch for new videos as well. Huge. Before we do that, we have to acknowledge the passing away and death of our sister Cicely Tyson. Huge giant in the field. I'll be amiss without mentioning that one of the many people we've passed away and lost over the last year. We're moving into this year. But, you know, always staying positive as usual. Even though we are apart, we'll go much further together. I'll see y'all soon. Check us on Clubhouse. Take care. Stay safe. Stay where. Peace.